Good evening, and thank you all for joining us for our final virtual CAO information evening for 2021. My name is Caroline Duggan, and I'm one of the student recruitment officers here at the university. This evening, we are focusing on the undergraduate degree on offer, the undergraduate degrees on offer in the College of Medicine, Nursing and Health Sciences. And before we start, I just wanted to run through with you kind of the agenda for the evening and some quick housekeeping as well. So we're going to start shortly with a presentation from our School of Medicine. Professor Geraldine McCarthy is going to give us an overview of medicine at NUI Galway. Geraldine is also the Dean of Medical Education at our Sligo Medical Academy. Geraldine is then going to be joined by one of our fourth year medical students, Ellen Casey, and Ellen is going to talk to you a little bit about her experience of studying medicine at NUI Galway. Then at approximately 7:40, we are going to turn to our School of Nursing and Midwifery, and Teresa Meany is going to give us an overview of the undergraduate degrees in nursing at NUI Galway. She is then going to be joined by Andrew Hunter from our mental health nursing degree, Professor Declan Devan, who lectures in midwifery, and Sean Kelly from St. Angela's College in Sligo. Then it's going to be, we're going to be turning to our School of Health Sciences, and there we're going to have an overview of our health science degrees from Mary Pat O'Malley. Mary lectures in speech and language therapy at NUI Galway. And again, Mary Pat is going to be joined by some of our health science students. So that will be Saoirse, Roisin, Heather and Hannah will also join us for that. This evening is all about you. It's about getting the questions that you may need answered. I'm sure lots of you are looking at your CAO application forms as we speak, and you're looking at making decisions. So hopefully tonight you will get the information you need in order to make an informed decision about your CAO application. Tonight we're also joined by Mary Serlis, our colleague from the Access Office, and we're joined by Oisin Cusack from our Sports Department. So both of them are also available to answer any questions. So for your questions, what I would encourage you to do is pop them into the chat function, and we will have a team answering those questions through the chat function, but we'll also be putting them to our panels tonight as well. So I would really encourage you to use the chat function. This is a fantastic opportunity to get your questions answered. So I'm going to call on my colleague, Professor Geraldine McCarthy, to turn on her camera and mic. And as I said, Geraldine is going to give us an overview of medicine at NUI Galway. Thanks, Geraldine.
Hello, everybody. Delighted to be here tonight, and delighted to get the chance to tell you about studying medicine in NUI Galway. And just make sure all the technology is working. I hope everybody can see the screen now. So as
yeah, that's perfect, Geraldine.
That's great. So as Caroline was saying, I am a clinician. I'm a consultant psychiatrist based in Sligo in the Northwest, but I've been working with NUI Galway for quite a number of years now, and I'm the Dean of Undergraduate Education in Sligo Medical Academy. And I think it's wonderful to be talking to you tonight with all our colleagues from the different specialties across nursing and health sciences, because these will be the professionals that you'll be working with if you choose a career in medicine throughout your working life. So getting an understanding of what we all do is really, really helpful. So I'm just going to go through a little bit about the course, a bit of things that students have said to me as to why they've chosen Galway and what they like about Galway, and hopefully if there's any questions we can answer them as we go along. So it's really been fantastic this year because NUI Galway won, was awarded, Best University in the recent Sunday Times ranking, and it's something that we're all very, very proud of. And really, the Dean in the School of Medicine was commenting just on some of the really innovative work that's been done within the School of Medicine in COVID times, and some really internationally renowned work at a time when we're all really struggling, to work on the clinical side too. So, you know, people like Maura Connolly, who's done work with the WHO for many years, like Dr. Barbara McNicholas, who's an anaesthetist in University Hospital Galway. She did some international research that was published in The Lancet, one of the most reputable journals in the world, looking at nursing people on their tummies when they've had COVID in ICU. So as well as some newer research looking at just using you know, video consultation for people in ICU. So lots of really, really super work being done, which is an exciting time to be part of Galway for that. But as well as that, you know, the NUIG is one of the top universities in the world, and there's been lots of really great investment in the university in recent times. With I'm sitting in Sligo Medical Academy at the moment, which is at the top 2 floors of Sligo University Hospital, and there's been similar investments in all of the Celta hospitals in Letterkenny, in Castlebar, in Ballinasloe, as well as in Sligo here too, with some superb facilities developing on the campus in Galway, with an absolutely state-of-the-art simulation facility, which is happening now too. So if you choose to do medicine in Galway, you'll really get some, you know, fabulous facilities to work in, and I think it's the value placed on the student education that's so important. So, you know, what's required to become a doctor? It's interesting, at the moment we're actually reviewing our curriculum, and it's something that we do really, really regularly. But, you know, somebody who qualifies as a doctor from NUI Galway is showing professionalism, is working as a safe practitioner, somebody safe to look after me or you or your family, is a good communicator. And we have the opportunity to work in very small groups. I was doing communication skills just yesterday with just a small group of 4 students who were doing their psychiatry attachment in Sligo at the moment. And it's interesting, even just talking to them yesterday, you know, 2 of them had done the 6-year program and 2 the 5-year, and the 2 that did the 6 had gone straight in after leaving Cert, and the other 2, one had done a year in biomed and repeated her HPAT, and the other repeated their leaving and HPAT to get in. So, you know, each of them had different pros and cons for those different, the 5 or the 6 year. You'll also be a collaborator and a curious learner, because throughout your career in medicine, you're always learning new things. We've had to learn so much in the last 2 years as a world, not to mind in medicine, and change the way that we're doing things and develop how we're working. So, you know, we have a modern curriculum. What's really nice if you join in pre-med, even at that stage, you'll go and get some early patient contact, and students really love this, the chance to go onto the wards and sit and chat with somebody and take their history. Very much a student-centered course, and we've got some brilliant teachers, really enthusiastic, love what they're doing, and people that have been working there a long time, and then lots of new people that do it as part of their professional training as well. We really try and take the whole holistic approach, and you know, want people to develop as well-rounded individuals, not just as good doctors. And we're unique in Ireland with the academy structure. So in other universities, when you're going in your clinical placement, you are in the big hospitals, for example, in Dublin or Cork, but then you go to peripheral settings, maybe for a few weeks here and there. But with NUIG, you go for a full year, and students really, really like that. They really feel that they engage within the hospital and get known there, and get to be get the best experience that they can within their communities. And as I say, we have very good patient-student ratio as well. So we, you know, work in very small groups. And even in COVID, we've managed to ensure that there's never too many students at any one time on the ward. And they also get some, you know, really good clinical teaching too. So throughout your 5 or 6 years in medicine, you're learning all of the time, and in the early stages you're learning about how things work normally, if you like, and the basic sciences. So some people will have done the 3 basic sciences, you know, physics, chemistry and biology, before they come in, but other people won't have. And students would sort of say, when they're picking their subjects for Leaving Cert, you want to pick what you need, but also pick what you like. So some students will pick subjects that maybe aren't as relevant to medicine in general, but are certainly something that they enjoy to do, like something like music or art. And I think everything is of benefit as a doctor. And then the later couple of years, then you're learning more in relation to how things don't work. So abnormal structure and function. And then so pre-med and first med it's more normal function, second med and part of third med is more the abnormal function, if you like. And then the second half of third med, you go out onto the wards and you either go to one of the academies for a year or you stay in Galway, and then the following year you go to an academy. And students really love the clinical practice part of things. So as I was saying, you know, foundation of first year, you're learning anatomy, how the body works, and working with cadavers and working with bodies just to actually see how the muscles are attached and what's actually happening. You get to work in the lab. And as I say, then you learn more about how, you know, how things really work and how things don't work. So in the clinical years in third med, which is either your third or fourth year, you're on the wards, seeing patients, studying medicine and surgery. You may see other specialties like anesthetics, radiology, and you learn all about the basic clinical work that you need to do. And then in fourth med, you cover obstetrics, looking after women in pregnancy, pediatrics with children, psychiatry, which would be my specialty, and general practice. And then back when you do final med, you go back and cover all the, you know, the more detail in medicine and surgery and the specialties to really become a well-rounded doctor. So it's very much clinical learning, and students really love this, and they can, you know, really get immersed with the teams, but also we learn quite a bit of simulation. So I'm just doing a little video here, just showing you some things that you might see in the academy.
First week in the hospital, all I wanted to do was eat, sleep, repeat. In the hospital and you know, talk to patients. I loved it. I loved the environment.
Just the fact that I got on so well with the patients did kind of make me feel like I can see myself doing this for the rest of my life.
I think medical students provide a little bit of a liaison between the patient life and the actual doctor life. And I think the patients are very happy to have us around because they feel comfortable asking us questions.
Working in a community-based healthcare, you really get to know your patients, and they always have a story to tell and why they're there. And so even though I'm here to learn about medicine, I think the biggest takeaway was really getting to learn about people's lives and how medicine shaped them, be it our teaching staff or even our patients.
It's probably something that does apply to all the academies, is the kind of friendliness of the staff and the engagement with, you know, the teachers, that they kind of get to know the consultants and the consultants get to know them by name.
We have consultants that are very, very committed to training and teaching. So people get a really, really rich clinical experience here, and we try to teach empathy and compassion as well. And I think, you know, anywhere in the world, you know, try and beat that really. The most interesting part, like the scenery. I was honestly mesmerized by the views. I could not take it in. And you know, like I usually take pictures to show my family, but literally no picture did any justice. There were mountains on the side, there was like the farms on one side, and then the beach and the waves and the skies, and it was just breathtaking. And I don't really get to experience that much, you know, where I'm from.
It's so different than what it would be like if I was in Dublin, and I think I'm very happy to have this very unique experience that I will remember forever.
So that just gives you a little bit of a flavour of the different facilities where you would be on your clinical placement, and there's just a picture there showing the Donegal, Sligo and Mayo academies. So, you know, it is something that students really like, and I hope, you know, if you choose to come to Galway, you'll get that experience. And the other thing that COVID has developed for us all is that students now wear scrubs routinely in the hospital. So when you go on clinical placement, you'll get to wear these lovely turquoise scrubs with medical student on the back of them. And these are just some of the students from Mayo Medical Academy who graduated in 2020. This was the first wave of COVID. So they were all very happy to finish and started work and are continuing to work now, which is great. So as I was saying, you'd be working or you'd be training in each of these Sailta hospitals as well as in Galway. And this is just a kind of a map, and I think it's quite nice just to show how everything is just sort of so close together. And this is something students would say to me a lot, you know, when they go to Galway, that everything is so accessible. So you've got you can see the campus of the university, which is right beside the hospital campus, and is also right beside town. And student accommodation is all very close as well. So they really get the sense of being part of the community in Galway, and you can kind of walk everywhere that you want to as well, which I think is really great. And then when you go into the communities in the academies, you know, they are smaller areas as well. So I think that makes it a very positive experience too. So you can kind of see that there's, you know, the research facility, the hospital campus, all very, very close to each other. One thing that we've been developing more and more is simulation, and there's been a huge development with a very large simulation space in the Clinical Science Institute in Galway, and it's really going to be something special when it's all completed. But we've been doing a lot more simulation work, and so that's working with pretend bodies, if you like, and practicing your clinical skills, like learning how to take blood, or to put catheters in, or, you know, to do, you know, physical assessments. And these simulated patients are quite incredible. I mean, they can set up any kind of medical emergency, and then you have to learn how to respond to it and deal with it. And, you know, it really is great to learn to do it in the clinical setting before you actually do it with a real patient. And I think students really enjoy that too. There's also opportunity to try sort of surgical skills. It's probably good that you practice that before you actually are let loose in the world too. So that's something that the students kind of get to do. So NUIG students do really well kind of clinically and academically, and there are awards for NUI universities around the country, and Galway is always really, really well represented. I'm afraid the pictures from 2020, because they weren't able to get together this year, but, you know, every year they've done really, really well, and it's a sort of a measure of the really good clinical experience that they get and the really good clinical knowledge that they have, and it's something that we're all really proud of. So basically, you want to do medicine, it can be a 5 or 6 year course, and it's about 200 students per year, about 60% EU and 40% non-EU. And maybe in the chat we can kind of talk a little bit about why you might do the 5 or the 6 year. In general, the 5 year program is allocated based on, you know, if you have the 3 sciences, obviously that's going to be important. Chemistry and biology would be next, and then chemistry and physics third. What students would say is that, you know, if they're younger doing their leaving cert, if they're moving away from home, they often like to do the 6 year course. Whereas if you've maybe repeated your leaving, or you've done another year of something else, that you prefer to do the 5 year. But it is, you know, it depends on places, depends on you, how you've done, but it's good to have the 2 options, I think. And this is something that's quite new as well, which is quite fascinating. And I think if I was 30 years younger, I'd certainly think about it. It's this physician year program, so you can do a combined medical and engineering degree. And there's an incredible consultant, Professor Derek Keefe, who is a physician here. He is a doctor and an engineer, and you know, the way medicine is going and the developments and the science with that, and sometimes people are very techie that want to do medicine and are very good at maths or applied maths, and it could be something that someone might think about as well. So only a life lived for others is a life worthwhile. You know, medicine is a super career. I've been doing it for more years than I care to remember, well over 30 years now, and you know, every day is different and every day is really enjoyable. And I think whatever you do in your life, if you find something that you really enjoy, it really does make a difference. So what is it actually like? It is hard work. It's, you know, I think anything that you really want and really want to do well, and it is hard work, and it can be stressful at times. This past year or two has been pretty tough, and you know, I work with older people who've been lonely and isolated, and you know, had to cocoon and very concerned. But yet you can really make a difference, and I think that's what's really good. And as I say, no day is the same. And the beauty is as well is that there's so many different specialties that you can do that can be so different to fulfill, you know, what it is you want to do. And I think another really important part is that whole doctor-patient piece, is that, we're really fortunate, people trust us to tell us their stories so that we can try and work out why they're presenting with that problem in that way at that point in time, and work with them to develop a plan to kind of get better. And it's something that, when students get on clinical placement, they really do enjoy as well. And then when you finish your degree, the world's your oyster, and there's so many different specialties that you can do, all, very different. I have friends that have worked for Medicine Sans Frontières, setting up health systems in Angola. I have friends that are surgeons, I'm a psychiatrist, general practice. There's literally so many specialties, and there's something for everybody. If you prefer to work in the lab, if you prefer to do research, if you prefer to work in the community, there is something for everybody. And it's, a starting point is great, but there's so many different things that you can do then. Just a few little pictures just to show this. The Human Biology Building is a beautiful new facility on campus. And there's lots more infrastructure planned with development of, just like the academies and all the smaller hospitals, the Master Medical Academy, as well as I was saying, the Centre for Clinical Simulation, which is super as well. Plus research, you can do student research in the summer and get paid for it, and really get yourself on the career path to develop things further, and lots of different ways you can do it in all of the academies as well as in Galway, and something students really like to do. Tend to do other sort of more fun stuff earlier on, and go traveling and work in the summer doing kind of regular jobs, but certainly later on in your career it's quite a nice thing to do. So why choose Galway? I mean, it's a lovely place to be a student, I think. The course is challenging, brilliant experience, it's very friendly, opportunities for research, lots of things that you can do and engage, and lots of really positive things like community engagement, and lots of great volunteer work where they do fundraising for various charities. So I think it's a really nice place to be a student and to develop as a person and professionally as well. Thank you. So sorry, I'll stop sharing there.
Thank you, Geraldine. Ellen, I might ask you just to turn on your camera maybe and your mic first,
yeah,
because there's lots and lots of questions coming in for you. So I'm going to start because there was a number of questions around subject choices for the Leaving Cert. So one student was asking us, was it necessary to have chemistry as a Leaving Cert subject? And if they didn't, would that be a disadvantage? So I don't know whether Geraldine or Ellen, if one of you wanted to take that. Ellen, I know you came in on the 5th year program.
Yeah, I did.
So how many science subjects were you doing, Ellen?
I did 2 science subjects. So I did chemistry and I did biology. I think that chemistry is necessary to do the 5-year program, but it's not necessary to do the 6-year program. So if you do the 6-year program, then you would do chemistry as a module in year 1, and then that would put you on par with everybody that had done it for their Leaving Cert when you go into year 1.
Okay, so we'll just recap there. So if you do want to be eligible for the 5-year medical program, you do need to be taking chemistry as a Leaving Cert subject. But even if you're only taking one science subject, maybe that's biology for your Leaving Cert, you are still eligible for medicine at NUI Galway, but you will be definitely coming in on the 6-year program. Does that kind of sum it up, Ellen? Yeah, brilliant. Okay. Geraldine, maybe you might take this end of the question. Do you think if you're not taking chemistry as a Leaving Cert subject, are you disadvantaged, do you think?
I think, a lot of universities insist on chemistry, and chemistry is something that, it's a difficult enough subject to do. It's still totally possible to get through, because you are going to cover it in pre-med. And, I know plenty of people who didn't do it, but the majority would tend to. So I suppose it's to try to make it as easy for yourself when you're actually in college, and I suppose Ellen could probably answer that as well. So it's not absolutely necessary, but you're certainly going to have to learn it at some point.
Okay. Yeah, brilliant. Okay. Another question came in around physics as a subject, but I mean, I suppose it's a science subject. It'll be acceptable onto the 6-year medical program. But again, it is a good subject for medicine. And certainly, I suppose, if you're thinking about the physician year stream, having physics for your 5-year might be very useful. Would that be fair to say?
Yeah, I mean, I think, I think with your leaving cert, what students would always say to me is that, it's important to pick subjects that you like, and that, you really want to work at. I mean, sometimes people find that the science subjects easier to kind of not as much predict, but, you've certain things to do and you've certain ways to learn it, and that, you know how you've done in a question when you've done it. But physics wouldn't be, you wouldn't have to do it beforehand, but you're certainly going to cover some of it when you're in college. So, I think, and certainly have core science, but then pick subjects that you really enjoy as well, because I think, that is important, and you will study them and you will like them. So if you're a really gifted musician and you love music, it's still worthwhile doing that too. It's something that you'll enjoy. It'll give you a little bit of time and space.
Yeah, that's great advice, Geraldine. Thank you. Ellen, I just want to come to you because obviously the transition from, a leaving cert student into first year as a medical student, it can be, was challenging, also extremely rewarding, because if this is something you've really wanted, you've landed and you're obviously super excited. But can I take you a little bit back to first year maybe and just tell me what that transition was like for you?
Well, it was an experience. It was quite a shock to the system. Obviously, I had come from leaving cert and I'd worked really, really hard. So I hadn't completely fallen out of the study habit. I did enjoy myself for the first couple of weeks anyways. And then there were times I went straight into the 5-year course, and there were times in first year I lived in student accommodation with students that weren't in medicine, and there is a difference. Where I did think, oh, maybe I should have done the 6 years and not gone straight into the heavy lifting. But at the same time, now I'm very glad that I did what I did, and I had a good time in first year, and I did go out and I enjoyed myself, and I still worked hard, and I still, I passed. So I suppose if you're willing to, you can have your fun, but you need to be willing to work as well, especially in first year, because it can be, and a lot of people do find it difficult in first year, and they don't realize what the exams are going to be like, and they end up repeating 1 or 2. And that's fine as well, but you need to be aware that it can happen easier than you might anticipate, especially coming from leaving cert, when you're kind of, if you get it first time, or if you get it at all, you're going to be like up there top class, and then all of a sudden that's not the case anymore because you're on par with everybody, and that can be a bit of a shock, but it's manageable.
Yeah, I've heard that a fair bit actually, Ellen, that because obviously the student who's going for medicine tends to be, in their school probably a particularly bright student, and then all of a sudden you're in with all these bright students, and it can be a bit of a shell shock.
Yeah, definitely.
Yeah. Brilliant. Thanks, Ellen. I'm going to come to you, Geraldine, because obviously as Dean of Medical Education in Sligo, you see the students coming to you probably. When do they come to the medical academies, Geraldine?
Okay.
In what year?
Yeah, so they come in third med. Okay, so if that's either your third year or your fourth year, depending whether you're doing the 5 or the 6 year course, and they come at the second semester. So they come in January. So there's a group outside my office here studying now, getting ready for their exams, just like Ellen. Thanks very much for for being here today. So they come for the second half of third med, so semester 2 of third med, and the first half of fourth med, or they come for the first half or the second half of fourth med and the first half of final med. So they come from January to December. And they quite like that, because I think, they really feel that they're kind of immersed in the place and get to know it quite well, I think. Yeah,
that's really interesting. Actually, another question for you, Geraldine, because a few students are asking about specializations. Okay, so obviously you've mentioned psychiatry, so that's now coming up there. Pathology is also coming up, as is dermatology. So just tell me the process, to qualify. Obviously, you're qualifying initially as a medical doctor, and then how do you go on to specialize? Just explain a little to us about that.
Okay, so when you qualify as a doctor, you work for the first year, you're called an intern. So to fully qualify, you have to do that intern year, which is generally, you cover sort of medicine and surgery. That would be the main areas, but so different specialties in medicine a little bit as well. And then you have to kind of decide, what area would I like to go into? So there's actually training schemes then for pretty much everything. So what people would do is that they might decide that they want to train to be a general practitioner. So they could apply for a scheme. So that takes about 3 or 4 years to train as a GP. Or if you want to train in dermatology, you would do a basic specialist training scheme for a couple of years in general medicine, and then you would go on to particularly specialize in dermatology. Dermatology is very popular and it's very much in demand, and so there's a lot of competition for that. So sometimes people would do maybe some extra things. Sometimes people do a master's. Sometimes people might even do a doctorate if they're particularly interested in something. And then in psychiatry, we have a basic specialist training scheme, which is about 3 or 4 years, and then you become a higher trainee and then eventually a consultant. So for most people, we're probably talking about 9 or 10 years after you qualify, which kind of horrifies people a little bit, but actually, basically you're working, you're getting paid, and you're just building up your skills. And people go and travel, and they go and work in Australia, and they go and work in America, and they get lots of great opportunities, because when you're a doctor, you're a doctor.
Yes.
And there's lots of opportunity for that. So it's about, and it's about trying to find the area that you think you'd like to work in, basically. Yeah.
Brilliant. Thanks, Geraldine. I've always actually wanted to know that myself, so thank you. I'm going to come to you, Ellen, or maybe Geraldine, probably both of you, but I suppose a question that certainly me and my colleagues in student recruitment would get asked in the classroom quite a lot from students, who really have their hearts set on medicine, and they're worried about, the points, and they're worried about the HPAT. Are there, kind of an alternative, so a plan B, I suppose, if the plan A doesn't materialize and you don't get medicine the first year you apply for it, is there kind of a plan B that you have seen students kind of go that route? Ellen or Geraldine, whoever wants to take it.
It's funny, I literally asked that question to a group of 4 students yesterday. Okay. And so 2 of them got straight in, and they decided to do the 6-year course. And they decided that because they were quite young and they were moving away from home, and they thought they'd give themselves a chance to settle into college. And the other 2, one had gotten on fine in her leaving cert, but hadn't gotten it in the HPAT. So she did biomed for a year and repeated her HPAT, and then joined in the 2nd year in the first med. And the other guy hadn't gotten it either on the leaving cert or on the HPAT, so he just repeated, and he got in then and did the 5-year course. Yeah. So so they would recommend, if you have the leaving cert points, that to maybe think of a science type subject that could then make it easier for the next year, that would facilitate maybe going to the 5-year course. Yeah. So it is difficult, and people really set their heart on that. Other options would be at a later point, completing another degree and maybe looking at a graduate entry option.
Yeah, that's very good advice. Ellen, in your experience, I mean, I know obviously you came in on the 5-year program, but probably there are students on your program maybe who didn't get it first time out.
Yeah, there are, and that was something that I was quite surprised at when I first came into first year, is that an awful lot of people would have done something else first, or would have repeated their leaving cert or their HPAT, a lot of people. So it's definitely a good option to do. If you do a science course, it can definitely be helpful to you later on. But even if you didn't and you just had to repeat your HPAT, I know people that did that and still went on to do the 6-year course, because if you do the leaving cert twice, it's hard to go straight into first med after that. Yeah. But it's definitely doable, and a lot of people do it.
Yeah, that's great. Thanks, Ellen. So just maybe to recap for students around what Geraldine and Ellen were saying there, one option that students do look at is maybe to take a degree like maybe biomedical science, or maybe the Bachelor of Science at NUI Galway. Maybe their HPAT is what's let them down. So maybe they have a very good leaving cert score. So they will resit the HPAT, but they will also reapply through the CAO for medicine, putting down NUI Galway as their #1 choice. So obviously then if their HPAT score comes up, they will be awarded medicine through the CAO at NUI Galway. And because you have successfully completed that first year on biomedical science, or indeed the Bachelor of Science, then we allow the students transfer onto the 5-year medical program. So there is no kind of additional fee implication for the students. So that may be a plan B for some students who maybe are looking at that route. Ellen, I know that COVID has obviously been, obviously, and for Geraldine as well, obviously a major challenge, and obviously probably impacted your ability to do some overseas study. But in general, can you just tell me a little bit about those opportunities? Because again, it is something that really interests students, those opportunities to go abroad as part of their program.
Yeah, so when we were in 2nd year, pre-COVID, because COVID hit when I was like halfway through second year. We got the opportunity to apply to go on Erasmus, which would have been second semester of third year. And there are 4 countries: France, Germany, Switzerland.
I think Sweden maybe as well.
Sweden as well.
Yeah.
And we applied. I applied. A lot of my friends did. I think you're at a bit of an advantage if you have another language, or if you have a lot of people do diplomas in another language in first year and second year. I hadn't done that. I just had my Leaving Cert French, but I applied anyways, and it's based off of your second year results. But then obviously COVID hit when I was halfway through second year, and Erasmus was cancelled pretty rapidly, so that was the end of that for us. But I know a good few third years in the year below me who are heading off now after Christmas for their semester abroad, and I know they're all really looking forward to it. And there's a few people in my year who are going away next semester as well. I think it's a module that you can take abroad for second semester of fourth year. Yeah.
Brilliant. Geraldine, did you want to come in there on that?
Yeah, no, I mean, the Erasmus is something that actually they don't do in the other medical schools. Erasmus, I mean, they do in other universities for other courses, but it's something that students really like. I think it's about 20 or so going this year. It's a pity you guys missed out, but I'm sure you'll get to go to nice places at some point. And it is a great experience. They really, really enjoy it. And, you know, you get to go and work and immerse yourself in kind of clinical life in a different country and get a real taste for that. So I think you do have to do fairly well in your exams in order to be eligible for it. So I suppose it's just to make sure that you can kind of keep that grade up as well. So
yeah. Brilliant. Thanks, Geraldine. And just one final question. One student asked about PhD opportunities. So to continue with your studies after you've completed your medical degree. Geraldine, do you want to take that one?
Yeah, I mean, it's something I would have done myself. Well, I did a doctorate in medicine myself, when I was doing research. It's possible to do it sort of integrate with the degree as well. And there's some really fantastic researchers in Galway and in a whole range of areas. So if that's the area that you want to do it, it certainly is something that's possible. It's a great opportunity to kind of advance what you're interested in and to work with some really excellent clinicians. So if it's something that you want to do, I would definitely encourage it. And there's always one of the things I didn't mention so much about is the summer research projects. I mentioned it, but you can actually do projects with some of these leading researchers over the summer, over an 8-week period. You actually can get a grant to get paid. It's about 250, 300 euros a week for that. And so you can get a publication out of that. And that might be your route into decide, oh gosh, I'd really like to research that a bit more and get a qualification. You can do masters in teaching, you can do masters in surgery. There's lots and lots of different qualifications. You'll be doing lots and lots of things for a long time, but if it's stuff you like, it's great, and I think if it's for you, that's superb.
Great, thanks, Geraldine. Ellen, I'll come to you as for the final word on medicine at NUI Galway. Was all the hard work in the Leaving Cert worth it?
Yeah, definitely. Yeah, it definitely was. I'm really enjoying it now. I'm really in the clinical side of it now because we missed it a bit out on that last semester as well. So it's definitely worth it now. Yeah.
Yeah. Okay. All right. Listen, thank you so much, Ellen, for taking time away from your studies. So that we really appreciate it. And Geraldine, thank you. I know how busy you are in Sligo. So thank you so much for taking the time to talk to the students this evening. I know there's still lots of questions coming in, so we will try and answer those in the chat for you. And if we don't, we will definitely come back to you with additional answers after this. Okay. So thank you, Ellen. Thank you, Geraldine. I'm going to call on Teresa. If Teresa's there, maybe she could turn on her mic and her camera, and we will start on the presentation from the School of Nursing and Midwifery.
I'm just going to give you an overview of the nursing and midwifery programs that we offer in NUI Galway. So there are 3 programs that we offer: Bachelor of Nursing General Nursing Program, Bachelor of Nursing Science Mental Health Nursing, and Bachelor of Midwifery Science. Now, these 3 programs run over 4 years, and at the end of the 4 years, students become registered general nurse, registered mental health nurse or a registered midwife. The 4 years of the course consists of 2 semesters, and the semesters run from September to Christmas. That will be semester 1, and semester 2 then runs from January until May. And in each semester, there are theory and practice modules. So the theory modules consists of either nursing and midwifery focused modules, and also biological science modules. And these modules consist of topics like anatomy, physiology, pharmacology, bacteriology, microbiology, and pathology. And students also study social sciences, and topics that will be covered in this area include philosophy, law, psychology, philosophy, and social sciences as well. Throughout the 4 years of the program, students study clinical skills, and there's a huge focus in clinical skills. So as well as the theoretical components of the modules, there are also practice components. So students go out into clinical practice, both in the hospital setting and in the community setting, both for general nursing, mental health, and midwifery students. Practice placements commence from year 1. So students, for example, first year student nurses, midwives, they come into college in September for 8 weeks. And after that 8-week period, the students go out into clinical practice. So in that first semester, from September to Christmas, students have 4 weeks experience out in the clinical area. And after Christmas, they go back out into the clinical area again. So throughout the 4 years of the program, the students have a combination of both theoretical and practical components. Students really enjoy linking the theory with the practice, and they really look forward to coming back into college for their theory components, and then, you know, learning skills in a very safe environment in the clinical laboratories, and then going back out into practice into the clinical areas. In the 4th year of the program, both for midwifery and general nursing, students spend 36 weeks in clinical internship. And during this period of time, students actually get paid a salary for 36 weeks duration. And the students come back into college for 4 weeks in the fourth year. And in that period of time, they study things like management and management issues, and they do a lot of simulations in relation to clinical practice. Also, St. Angela's College, Sligo, Sean will be here this evening to answer any questions about nursing in St. Angela's Hospital in Sligo. And in St. Angela's College, Sligo, they run 2 courses in nursing, one for general nursing and the other learning intellectual disability nursing. And the intellectual disability nursing program in Sligo, St. Angela's College, Sligo, is based on the principles of human rights, person-centeredness and empowerment. And the principles underpinning this program are principles of autonomy, active participation, inclusivity for persons with intellectual disability. And the course is offered in conjunction with the Health Service Executive in the groups in the Western region of the country. And again, the BNS Intellectual Disability Nursing Programme has placements both in the community and in the hospital, and it's a 4-year degree programme. And the 4th year, again, students do their internship. In the School of Medicine, School of Nursing and Medicine and Health Sciences, nursing is part of this school. So you've got the Bachelor of Medicine degree, Bachelor of Science, Occupational Therapy, Speech Therapy, Podiatry, and then you've got a Bachelor of Nursing, Science General, Bachelor of Mental Health Nursing, and Bachelor of Midwifery Science. Also, when a nurse or a midwife qualifies and gets their Bachelor of Nursing degree or their Bachelor of Midwifery degree, they also are eligible to be registered on a professional register. And the Nursing and Midwifery Board of Ireland is responsible for the registration of nurses and midwives. So as when you complete the 4-year course, either in nursing or midwifery at NUI Galway, you also are eligible to be registered as a registered nurse or midwife with the Nursing Board and Nursing and Midwifery Board in Ireland. So if you're thinking about nursing and you think you may want to be a nurse or a midwife, there's different things you can think about. Like, are you somebody that likes meeting people and working with people? Do you like listening to people's stories, and are you interested in others? Are you interested in health and well-being? That's something else that you should consider. Is this something that you're interested in? Are you somebody that's flexible, adaptable, and to different situations that can arise? Do you like to analyze and problem solve? Because as a nurse and a midwife, there will be a lot of challenges and issues that you may have to analyze and problem solve on a daily basis. And are you self-aware? As a nurse, you will be, and a midwife, you will be caring for other people. So it's very important that you have self-awareness. And the other thing that's so important in nursing and midwifery is the teamwork. So working as part of a team. Do you like working with other people? Have you got good communication skills? And are you somebody that likes, you know, have you got good oral and writing skills? So those are things that maybe you should consider if you are considering to become a nurse or a midwife. So the courses in NUI Galway, the first course we look at is Bachelor of Nursing Science General Programme. And this programme, you become registered as a general nurse. And the role of the general nurse is to assist with the health and well-being of persons experiencing a change in their health status. And as nurses, we care for patients. We look after their physical, psychological, emotional, social, and spiritual needs. So it's a holistic approach to caring for people. The course provides an excellent foundation in the theory and practice of nursing and enables students to become competent, knowledgeable, safe, and highly skilled practitioners. On graduation, nurses are eligible for registration on the General Nursing Division of the Nursing Registrar, which is maintained by the Nursing and Midwifery Board of Ireland. This year, in 2021, the points for nursing were quite high, 496 points. And if we compare it to 2020, it was 476 points. The places that are offered in NUI Galway, the number of places offered for general nursing has increased to 84 places. And the requirements for nursing is you need a science subject. So the subjects for science would be either chemistry, physics, biology, physics and chemistry joint, or agricultural science. And the other subjects would be Irish, English and maths, and then any 2 other subjects recognized for entry purposes. When you commence your course as a general student nurse, you'll work in lots of different areas in both the community and in the hospital. So as a general nurse, you would work in medical and surgical wards, accident and emergency, students find that very exciting, outpatients department where patients attend outpatients, pediatrics, care of looking after children. Again, in second year, students have opportunities to work in the maternity department, in mental health areas, care of the elderly, and operating theatres. Those would be the specialist areas that students work in. All the practice modules are based in the clinical setting, and students work either in the hospital or in the community. The theoretical modules are focused on nursing studies and also on the biological and social sciences, as I've mentioned already. Then the Bachelor of Mental Health Nursing. Mental health nursing aims to assist people experiencing mental health issues to recover and to promote mental health and well-being. The course is offered in partnership with Galway Roscommon Psychiatric Services and the Salehi University Healthcare Group. On graduation, students are eligible for registration on the Psychiatric Division of the Nurses Register maintained by the Nursing and Midwifery Board of Ireland. And in 2001, the points for mental health nursing were 441 points. And just to compare it to 2020, 440 points. And at NUI Galway, there are 30 places for mental health nursing. Again, it's the same requirements as for general nursing. You need your biological science and 5 other subjects, including English, maths, and a laboratory science subject. In mental health nursing, a lot of mental health care is focused on the community, but also as a mental health student nurse, you will also work in mental health hospitals. So in areas such as acute mental health services, working with older adults in mental health services, working with people with enduring mental health problems, working with specialist clients, and then students have the opportunity to take courses on psychosocial interventions. And again, the theoretical modules students will undertake in mental health nursing are mental health nursing specialist areas, acute and mental illness, also social sciences and biological sciences, which are shared with midwifery and general students. Now, as a nurse, whether it be a mental health nurse or a nurse working learning disability or a general nurse, there are lots of clinical pathways where nurses can work in many specialist areas. So as we mentioned already, nurses may choose to work in medical, become specialist in medical areas. They may also decide to work in surgery. Nurses can also decide to work in the community as public health nurses, work in specialist areas such as cardiac nursing, cardiology. They can specialize in diabetes, dementia, renal specialists, work in accident and emergency, intensive care, infection control, wound care, practice nursing, perioperative care, oncology, caring for patients, cancer patients. Some nurses work in occupational health. They become nurse practitioners. And also, if you're specialized in mental health, you can work in adolescent mental health, caring with older people in mental health, working in acute mental health settings. So there are huge areas for nurses to work in. Also, some nurses may decide that they have a special interest, like was said in the previous talk, on medicine, in research, or they may go into management, or they may decide that they would like to work in education. So when a nurse qualifies in the different areas, whether it be mental health nursing, in midwifery, or general nursing, there are so many areas to choose from. So the Bachelor of Midwifery Science then program, the midwifery degree program consists of theoretical and clinical components to it, where students learn the art and science of midwifery. On graduation, students are eligible for registration on the midwifery division of the Register of Nurses and Midwives maintained by the Nursing Board of Ireland. Students get a broad range of clinical experience in areas like Galway, Mayo, Portiuncula, and Sligo. The entry points for midwifery in 2021 were 520 points, and if we compare that to 2020, 495 points. In midwifery, there are 25 places in Galway. And as with mental health nursing and general nursing, again, you need the same English, Irish, maths, laboratory science subject, and any other 2 subjects. In midwifery, you learn the areas that student midwives work in are in the antenatal ward, where they care for women when they're pregnant, also working in the labour ward, where student nurses get experience of caring for women actually in labour, having their babies. And then in the postnatal ward, students work with mothers who've deliver their babies, and they care for mothers and babies in the postnatal setting. Also, during a student midwives 4-year training, they also work in the neonatal unit or the special care baby unit, where they care for babies who may have been born premature or babies who just need extra support after being born. Also, student midwives get an opportunity to work in the community, out in the community, where they visit mothers and babies in their home after delivery. They also get an opportunity to work in theatre and to work in the gynecology wards and to work in mental health areas. Again, for student midwives, their experience is a combination of theory and practice, where they work in the maternity area and in the community. Again, subjects that student midwives will study will be midwifery studies, childbirth, professional midwifery practice, and again, student midwives will do biological sciences and social sciences. And these biological sciences and social sciences, as well as sharing these lectures with mental health and the general students, they all, as a student midwife, you will also do applied biological and social science studies. As a midwife, again, there are so many opportunities when you qualify as a midwife. You may decide to work in the antenatal care, caring area, caring for women that are pregnant. Again, you have opportunities to work in the postnatal care, caring for mothers and babies during the postnatal period. Again, some midwives like to work in the labour ward, where they care for women having their babies. Again, some midwives, when they qualify, they go on and do a neonatal course, where they become specialists working in the neonatal unit. Again, there's opportunities for midwives when they've got experience to work out in the community and to join home birth teams. Other specialist areas that midwives may work in are areas where their education of teenage pregnancies. Midwives may also have a particular interest in breastfeeding, where they decide to become lactation consultants. Again, midwives can go on and do advanced courses where they can become advanced midwifery practitioners. Again, some midwives may like to work in theatre and specialise in perioperative care. Again, there's loads of opportunities for midwives to work in areas in research, education and management. So as student nurses or midwives, the whole goal is that as nurses and midwives, that we provide high quality, safe, efficient, compassionate care to our patients, whether it be patients in mental health, in general nursing or midwifery. And the care that we provide to our patients is always evidence-based care. The care is always patient-centred, where the patient is always at the centre of our care. And as midwives and nurses, we want to care for patients in an individually, in a holistic way. And communication is at the core of what we do, so that patients are treated with respect and dignity. And as nurses and midwives, we realise that we're in a very privileged position caring for patients. And as we've mentioned previously, as a nurse or a midwife, we very much work as part of a team. So work as part of a team among your nursing and your midwifery colleagues, but as well as that with the multidisciplinary team that will be working in the wards, for example, the doctors, physiotherapists, speech therapists. Everybody works as a team together, and that lies at the core of nursing and midwifery. As a student nurse and a student midwife, clinical skills are very much core to the programs in nursing and midwifery. And we want, when student nurses and midwives qualify, we want them to be knowledgeable doers. In other words, that students will continue learning, because as a professional, whether you be a nurse or a midwife, learning is lifelong learning. So students are taught to be independent learners, to be self-directed in their learning. And during the course, students are assessed. There's different methods of assessment, written examinations, coursework, and students also do simulated learning, where they carry out clinical skills and they're assessed on their proficiency at carrying out skills. Also in the clinical area, when student nurses and midwives are working in the clinical area, they are also assessed. Their skills are assessed in the clinical area, and they have to complete what is called clinical competencies. So student nurses have certain number of learning outcomes to achieve during their clinical experience, and they're assessed and supported by their clinical preceptor, and they have to be deemed competent at the end of their placement. And students really, really enjoy their clinical placement where they can put their theory into practice. As well as the requirements of achieving the points for the Leaving Certificate examination and achieving the required CAO points, students also are GARDA vetted before they commence as student nurses or midwives, and they also are required to complete a vaccination program. On clinical placement, students are supernumerary and they are supported by a registered nurse at all times during the 4 years of their degree programme. And the student has a preceptor, which is a registered nurse or midwife, and they facilitate students on the clinical area, and they complete the student competency and support students in the clinical area. Students are also supported by their clinical placement coordinator and by the link lecturer who visits the clinical sites. So in clinical practice, there is a lot of support for students as they go through the 4 years of their programme. As I've said earlier on, there's lots of career pathways for nurses and midwives. So a lot of student nurses, they usually choose to work initially, maybe for a year, and gain experience. And some students like to travel. So Irish nurses are renowned all over the world, and midwives for being very well qualified and very competent in their professions. So a lot of our students would travel, whether it be to London, to the US, to Australia, to New Zealand. And generally speaking, they come back again to Ireland, and they have opportunities as well when they travel to different countries, maybe to do different courses in those countries and to get experience of working in other countries. So student nurses and midwives find this a very attractive option, that when they do qualify as a nurse or midwife in Ireland, they have this option if they want to travel and to see a bit of the world and to get experience as a nurse in other countries. Also, some students may be very interested in, remaining in the clinical area, becoming a specialist in a particular area in the clinical area. And there's lots and lots, as I've mentioned before, there's lots of specialist areas that nurses, when they qualify, can specialize in. Also, there's opportunities. Some students may decide that they would like to work in education, and there's lots of educational programs, masters in education, are available to students if they're interested in going into the teaching aspects of nursing or midwifery. And research, there's again some students, particularly when they get into the 4th year of their program and they do their literature review, or some students as well have opportunities during the summer where they take on research projects. And again, they find that they have a particular interest in research. So some students may decide after having some clinical experience that they want to specialize in research. And also there are some students that are interested from a very early stage in management, and there is lots of management courses the students can undertake, and they may decide to become a clinical manager in the clinical area or in the community. So lots of career options for students as nurses and midwives. So this is a picture of the School of Nursing in NUI Galway. It's quite a modern building, and most of the lectures are within this Áras Maiola in the School of Nursing and Midwifery, and we've got very good clinical skills rooms, and it's a very modern and very nice building. Here you will see some of our clinical skills here. There is a student, she's performing an exam here where she's just done a blood pressure on a patient. So you can see our clinical skills rooms are, you know, they resemble what a hospital would look like, and the students work here in a safe environment. And again, here you will see some students there looking at the OSCEs that they have performed in practice. And again, you'll see other students here where they're caring for a child, an OSCE. So you can, further information you can get on the NUI Galway website, in the School of Nursing and Midwifery website, and on our Facebook. And again, the Nursing and Midwifery Board of Ireland, there's information on that. And we look forward to answering questions after this presentation. And apologies again for my technical issues in the beginning. Thank you.
That's great. Thanks, Teresa. Can I call on Andrew and Declan and Sean maybe to turn on their mics and cameras and to join us? That's great. Thanks, Declan. I'm just going to start because there's a lot of questions coming in on the chat. Some of them are repeated questions. So one that has come in quite a lot is around placement and where placements take place. Declan, do you want to take that question for me?
Yeah, sure, Caroline. Depending on the program students take, they can be expected to be placed largely within the CELTA healthcare group or their respective community care area that covers the large part of Letterkenny down through to Galway, Roscommon areas. And we would, across all our programs, indeed nursing, midwifery, medicine and other programs, use healthcare settings, be it in hospitals or community care areas across the region. And students will be placed in one of those areas. And as Andrew said in one of the chats to somebody, depending on the course requirements and the regulatory requirements, all students in all programs are required to get a certain number of weeks experience in particular specialty areas, and those specialty areas could occur across the region.
Great, thank you. Thanks, Declan. Andrew, I might come to you next, because a question we get asked quite a lot in the classroom is about, you know, exactly what a mental health nurse does. What service to patients does a mental health nurse provide? Could you just give us maybe an idea of what the day in a life of a mental health nurse might look like?
It's a constant issue within mental health nursing to define mental health nursing, and
yeah.
There is no single day in the life, and I would use a quote to start that, because there is no health without mental health. So if we think on a continuum, what you're going to have are nurses working in the community with people who've been referred by their GPs because they're depressed and anxious, and that, you know, you're looking at 1 in 4 people across the lifespan, or 1 in 10 people at any given time would benefit from that kind of input. So that would be in the community, right through to, at the other end of the scale, people who are genuinely at risk to themselves and require emergency input, so to speak. So they would be in inpatient settings, and that's where a mental health nurse would be doing shifts and would be with people 24/7 to make sure that they are getting through the crisis that they're in at that moment. And all of that is based upon, as Teresa was saying, excellent communication skills, and specific to mental health nursing is the ability to build therapeutic relationships and help people towards recovery, which is an ongoing process through life. And that is about identifying people's strengths and their needs and working to meet their own goals. So it's very nuanced, and it's very much about knowing what the person's individual needs are. About communication for mental health nursing.
Thanks, Andrew. I think that's one of the best explanations I've ever heard for what is involved in mental health nursing. So thank you for that. Sean, I want to come to you next, because St. Angela's do offer 2 undergraduate nursing degrees. Do you want to just maybe quickly mention those 2 degrees and just talk a little bit about the 2 of them for us?
Of course. So St. Angela's College in Sligo offer general nursing and intellectual disability nursing. So 2 very different courses. two very different disciplines. The general nursing course is exactly what NUI Galway offer, but we just offer it in Sligo, so it's a different setting. The clinical placement will also be based in and around the Sligo area for our general student nurses. A lot of placement for those students will be in Sligo University Hospital with our colleagues there. The second nursing course we offer is intellectual disability. And I do get asked a lot every year, well, what is the difference, or define what intellectual disability nurse is. So the easiest way, and hopefully the most clear way I can explain it, is an intellectual disability nurse graduate will be more community-based than, would say, a hospital setting or a clinical setting. So throughout the country, there have been these larger institutional hospitals that are home to service users with an intellectual disability, for example, Down syndrome or autism. So these larger institutions are closing as we speak. A lot of them have closed, actually. And those service users are being brought back into the community. So they're now living in community care homes, day settings, training centres, specialist care facilities, and of course, children with intellectual disabilities have to go to school. All of these areas in the community require a nursing presence. So that's where our ID nursing graduates end up. So hopefully that will explain the difference between both of the disciplines. The placement settings for the ID student nurses can go a little further than Sligo. We have partnered with areas in Galway, in Donegal, Mayo, and we've even gone as far as Cavan. So the ID clinical placement, or ID community placement, I should say, they can go a little further afield, as opposed to the general student nurses who will be mainly Sligo based. So hopefully that explains.
Great, thank you, Sean. Thank you. Another question that has come up a little bit is about, and maybe it's a question for both Declan and Teresa, but you know, the differences and the similarities between general nursing and midwifery. I don't know if one of you wanted to take that, Declan, maybe.
I might jump in.
Yeah.
So Teresa and I are both general nurses and midwives, and Teresa's focus now is in general and some midwifery, and my focus is largely midwifery with some general. The programs are quite different, although there is some shared content in the initial years 1 and 2 in particular. But they are quite different programs. The clinical placements really are very different. And therefore the theoretical input that students get from years, well, throughout all of the years, starts to prepare students for practice in those different clinical settings. So I would encourage anybody who's maybe to think carefully about which one to choose across any of them, across intellectual disability, general, midwifery, mental health. Think carefully about which program you think you're best suited for and most interested in pursuing.
Great, thanks, Declan. Teresa, did you want to add anything there?
Yeah, I think it's important to know that if you do a general program or midwifery or mental health, you become registered on that particular register, and you can only practice area. So as Declan said, it is important to know which area you really want to do and to pursue that area. Now, there are opportunities afterwards. For example, if you're a general nurse, you can go on later on and become a midwife by doing an 18-month postgraduate course. But it is important to know that once you're registered on a register, you can practice only within that registration.
Okay, thank you, Teresa. I think we've time for one final question. So Andrew, I might come to you. And again, it was a question that popped up quite a lot in the chat. It was around study abroad opportunities and Erasmus. You know, what are opportunities are there for the nursing students to do some study abroad?
Well, I think as Teresa touched on in her presentation, general nurses, midwives, and to some degree mental health nurses have huge opportunity to work overseas. They are sought after. It is the case that, and I would let Declan speak from a midwifery perspective and Teresa to the general, that mental health nursing have opportunities, but they're not as broad in terms of working abroad. And it goes back to that idea in the last question. They are very different disciplines and they do very, very different things, but the opportunities are there. Certain countries will ask further exams, further requirements for people to travel. But yes, they're I have certainly filled in numerous references, especially for people to go to the UK and work, all across the UK as mental health nurses. I know that general nurses and midwives are similar there. So, huge opportunity to travel out of all three of these courses.
Great, thanks. Thank you, Andrew. And I can't let you go because always when we're in the classroom, myself and Gráinne and Eilish, we are always encouraging the boys to consider nursing as a career. So I have Andrew and Declan in front of me, and I just want you to maybe we're very tight on time, but just maybe to say something to some boys who are listening tonight and maybe who are considering it. You're just on mute there, Andrew.
I was just going to say, mental health nursing tends to have slightly more, in the way of men with it. But, we're talking in a class of 30, we might have 2 or 3, even at this stage, or maybe 4. It is a great career with huge opportunities, community, inpatient, and working across the board. It is not considered as gendered as it once was. Perhaps I would let Declan talk here in terms of the opportunities, because in mental health, it's always been there. So I'm maybe not the best to talk to that.
Great, thanks, Andrew. Declan.
And in midwifery, there would be fewer men than in the other general nursing or mental health nursing, but increasing numbers across all of the providers of midwifery bachelor's degrees in Ireland and elsewhere. So we would encourage, I've loved it as a career. My colleagues who are also men have similarly loved it. And I would encourage anybody, don't put off, if it's a career you think for you, follow that career path. And I assure you gender won't come into an issue whether it's for you or not.
Great, thanks Declan, thank you. Thanks everybody, we've ran out of time unfortunately, so I do need to call in Mary Pat O'Malley. Mary, as I said, is a lecturer in speech and language therapy, and she's going to give us an overview presentation on the health science programs at NUI Galway. Thanks Mary Pat, and I can see your screen perfectly, that's perfect Mary.
Okay, I'm waiting for, okay, great. Okay, hi everyone. My name is Mary Pat O'Malley and I'm a lecturer in speech and language therapy, which is in the School of Health Sciences in the nursing building, as it has become kind of colloquially known. So I'm going to be talking through 3 undergraduate programs that we deliver in the School of Health Sciences. So occupational therapy, podiatric medicine, and speech and language therapy. Now, many of the things that the other speakers have mentioned are common across these professions because, of course, you're working with people who are experiencing different, let's say, health conditions, for example. And across those 3, so OT, podiatric medicine and SLT, and together with social care, we make up the 2nd largest clinical grouping of the healthcare workforce, working in a range of settings in terms of hospital settings, so acute hospital settings, community, the disability sector, primary care, residential services for older people, for example, going into nursing homes to assess difficulties that people have with swallowing from speech and language therapy. And very often we work as part of a multidisciplinary team. We're highly qualified and skilled and play a significant role again in the health, well-being and quality of life of the population across life contexts and really from birth throughout the lifespan. So again, what do the programs have in common? A supportive learning, environment. Our numbers tend to be small. So you get kind of the best of both worlds, I think, in a way, because you have, let's say in speech and language therapy, you'd have maybe 25, 34 is the maximum we've had in 1 year. So you'd have small class sizes, but then you also get to work together with let's say occupational therapy students in some instances. And then when it comes to human body structure and human body function or psychology, you would be in with medical students, psychology, for example. So you get that mix of the small class and then the bigger lecturing environment as well. And similarly to the other programs, we have a combination of theoretical and practical components. And in speech and language therapy, for instance, we have what's called an integrated or a spiral curriculum. So in first year, you would start, let's say, with learning about all the communication impairments that people can have. And then let's say how common they are, what causes them, what are the risk factors. And then in second year, you revisit all those same topics, but now we're looking at how do you diagnose them, how do you assess, and how do you develop interventions, with, say, for instance. Again, across the three programs, an emphasis on evidence-based practice. And when we think about evidence, it's important to bear in mind, we're not just talking about research here, we're talking about what the client and family, what they value and what they want, and also the clinician's expertise or experience. So there were three elements to evidence-based practice, and teamwork is also really important because a lot of the situations we're dealing with involve complex cases. You will also have an opportunity to conduct research, and we have had great success really with student undergraduate projects being published in international peer-reviewed journals. So that's, and you get to pick the area that you're interested in researching. So our programs are also fully accredited by CAO, which is the statutory regulatory body for the health and social care professions. And the title would say speech and language therapist is protected. So you can only call yourself a speech and language therapist when you are registered with CAO. And then the professional bodies for the different professions also accredit the courses. So it's very rigorous in terms of accrediting the programs. And we have a strong record of graduate employment across the three programs. So I'm just going to start off with OT and take you through, well, what is OT? So occupation is basically activities that we do every day that are important to us, that we enjoy and that contribute to our society. And occupation means different things to different people. So you can think about what are the things that you enjoy doing, and then think about what if you couldn't do them because you developed an illness or you had some kind of an injury which prevented you from doing what you love to do. Or it could be a case of that it is actually the surroundings that are preventing you from doing the things that you enjoy. Or you may have been born with a disability or into circumstances preventing you living life to the full. And this is where the occupational therapist becomes involved. So OTs work with babies maybe who are premature, children who have developmental delays, people with mental health difficulties, a young adult maybe recovering from a road traffic accident, an older person with dementia, a person recovering from a stroke, an adult with intellectual disability, or communities experiencing social exclusion issues such as homelessness. So again, across the three programs really and the three professions, there's such a wide variety of situations where the expertise of the professional is necessary, and you will never be bored. So what do occupational therapists do? And again, across the programs, there's assessment and intervention. So they look at, for example, how the person's activity and their participation in their lives has been disrupted because of maybe mental illness or physical disability or social problems, for example. And then the interventions will look at, and it's the same in speech and language therapy as well, in general, broad strokes, you look at, is there something in the environment we need to change? So for example, in the classroom, do they need pictures, like a visual timetable or a schedule of what the kind of structure of the day is going to look like for students so they can follow the timetable visually? For example, intervention working with the person to develop skills or advance skills, or is there something about the task that needs to be changed to help people make progress? And the goal is basically improved participation in daily life occupations. So the subjects and modules, anatomy, physiology, and psychology would be across OT, SLT, and podiatry. And then there would be specialist modules in neurology. And in second year, the occupational therapy students and the speech and language therapy students work together in neuroscience, and they do presentation about particular scenarios. Other specialist modules in OT would be intellectual disability, physical disability, pediatrics, mental health, and older adults. There's also social policy, community engagement, and as I said, you will do research, and then there's the practice education or the work placement component. In terms of the entry requirements, again, there are similarities across the three. So the points this year were 601. And the key thing I think here is another language. So you have your minimum grade H5 in 2 subjects. You can read that there for yourselves. And then including Irish, English, another language. So those are the entry requirements. Students are also required to undergo Garda vetting, it's mandatory, and medical clearance requirements. And this is because when you go on placement, you're dealing with vulnerable people. So we need to protect the vulnerable. And then vaccinations, for example, for Hep B and MMR are mandatory for placement in the HSE. At the moment, the COVID vaccine isn't mandatory, but placements may not accept unvaccinated students. And in occupational therapy, then students are required to act as models during practical sessions. So there's making of splints, for example, or measuring a joint and range of movement. So that's kind of the theoretical component, the modules, and now the practice education or the work placement aims to develop your professional competence and give you hands-on experience of what it's like to work as an OT and to practice skills and learn skills and experiencing the future work environment, and again, making links between theory and practice. So it's different across the programs in terms of how the practice hours are kind of divvied out really, but you will have all the required hours by the end of the 4 years. So in OT, it's 33 weeks. So there's 1 week in first year, 8 weeks in second year, 8 weeks in third year, and 16 weeks in the fourth year. And I'm not looking at the chat now as I'm speaking, but similar issues have been raised across the other programs around when you're on placement, it can be anywhere in the country. And there are costs associated then with going on placement in terms of accommodation and living expenses. When you are on placement, you will be supervised and assessed by an experienced occupational therapist, and you must pass all your placements in order to gain the professional qualification. Placement anywhere in Ireland, and some options are available for placement abroad, for example, in the UK, India, Canada, Australia, and Dubai. As I said, the graduates of the OT, SLT and podiatric medicine programs have gone across the globe, and current graduates from OT are working or have worked in the following places. So UK, USA, Canada, Australia, Singapore, Dubai, Haiti, and New Zealand. So that is the whistle-stop tour of occupational therapy. And now I'm going to move on to podiatric medicine. And what's podiatric medicine? Basically, it is a specialized health profession dedicated to the diagnosis, treatment, and prevention of diseases and disorders affecting people's feet, ankles, and lower limbs. And if you've ever had a problem with your foot or your lower limb, you'll realize how important the podiatrist is to helping in that scenario. So podiatric medicine, and what can it offer you? The opportunity to specialize in the foot and the lower limb, a chance to work as part of a multidisciplinary healthcare team with your specialist knowledge, the ability to confidently assess, diagnose, and manage conditions autonomously and help improve people's quality of life. So while podiatrists would work as part of the multidisciplinary team, they are autonomous professionals, same as occupational therapists and same as speech and language therapists. It's a practical hands-on career with scope for further professional development, and like the other programs as well, is a varied and challenging job. So the scope of practice for podiatric medicine, the areas of specialization, again, it's quite wide ranging and varied. So there's biomechanics, sports injuries. I know they've done in the past modules on forensic podiatry, looking at footprints and weight bearing. So there's podopediatrics, so that's working with children who have difficulties in the area of feet and lower limb, vascular issues in relation to people who have diabetes, minor surgery, wound care, rheumatology. So again, very broad ranging and very, every time I listen to the podiatrists talking about what they do, I think, oh, I'd like to do that. So the kinds of modules that are on the program, this is just a sample. So podiatric dermatology, so lower limb kinematics, human body structure, human body function, gross anatomy of the lower limb, microbiology, endocrinology, professional development, redefining health and well-being, and podiatric sports medicine. And again, the entry requirements also contain that another language element, and the Garda vetting and the medical clearance are part of the entry requirements also. So the placements in podiatric medicine are 1,000 hours of clinical placements across the 4 years, and the majority of those placements take place in the dedicated clinic facility at Merlin Park Hospital, where the staff from NUI Galway support the students on placement. Local and national placements, they mention international placements as a possibility as well, and multidisciplinary placements, again in various settings, the voluntary sector also. So the job opportunities, the employment rates again are very good. And that's just the pie chart there shows you the graduate employment information in terms of the HSE, being self-employed, private practice, working for Diabetes Ireland. There's opportunities to work with footwear companies or orthotic companies, sports clubs, to do research and postgraduate studies, and also to work in education. Okay, now coming to familiar territory for me, the BSc in Speech and Language Therapy. And basically, we are the professionals who are responsible for the assessment, diagnosis, and management of people who have communication and swallowing disorders. And we help people who have these difficulties to achieve their maximum potential to communicate. And this will involve working directly with the individual themselves, and indirect work with the family, carers, teachers, psychologists, for example, again, a wide range of other professionals. So talking about talking and swallowing, I invite you to try a little experiment here for me for a moment. So I'd like you to put your fingers on the bridge of your nose and say, and see if you can feel the bones in your nose vibrating. Now I want you to do the same. Keep your fingers on the bridge of your nose and say, "S," and see if you shouldn't be feeling any vibrations when you're doing this. And that's because if we look here, when you look into your mouth in the mirror and you see your palate at the back, or your uvula, which is a little dangling bit hanging down, when you're saying "S," the velum or the palate is closed up against the back of your throat there, and it prevents air going into the nasal cavity because it's not supposed to go in for "S." But when you're saying this would be down, and you would see yellow up behind it because the air would be going into the nasal cavity and causing the bones in the nose to vibrate, because is a nasal sound. That's a kind of a brief touch into the area of, we'll say, phonetics, which we do cover in first year, where we look at how sounds are made, how speech sounds are made, and all the different kind of components that go into making the speech sounds. So it's speech and language therapy. So speech is obviously about the production of speech sounds, fluency, let's say stuttering, or voice if you've got a hoarse voice. And then there's language as well, which is, let's say, more to do with the understanding instructions, communicating clearly, using grammatical sentences, we'll say, for example, and then swallowing. But it's broader than swallowing. It's feeding, eating, drinking, and swallowing. And again, it's from babies who are born prematurely and have difficulty feeding, or babies who are born with a cleft lip and palate have trouble feeding, all the way through to people, let's say, who've had a stroke and can't communicate effectively after that, or have difficulties with language, to people who have, let's say, dementia or motor neuron disease, for example. Speech and language therapists work with a very broad range of people. And I've just given you kind of some examples there. We'd also work with people maybe who have hearing impairment, who are neurodiverse, so people who are autistic, people with cleft lip and palate, people with intellectual disability, people with mental health difficulties. There are speech and language therapists who work with people who have chronic schizophrenia, for example, people who stutter, people like teachers, for example, who become hoarse. And certainly new areas to look at post-COVID are things like the communicating via mask and the impact on your voice of using a mask, and the stress it may put on the voice in order to kind of project, and head and neck cancer. So people can get cancer, we'll say, in their larynx, so it's in the throat, or in their tongue or palate, and speech and language therapists would be involved then in helping people post-surgery in terms of communication. So the different, basically from, birth across the lifespan, lots of things can happen. So a child can be born with the disability. For example, if a child is born or they experience oxygen deprivation at birth and then develop cerebral palsy, they might need to see the speech and language therapist, or they're born with the cleft lip and palate, for example. Or as they develop, it may become clear that they're not talking. Let's say they're 2 years old and they're not using many words yet. Or it could be somebody who has a stutter. So that could be a person at any age, really, a person with a voice problem. We work with people, let's say, for example, who are transgender and who want to change their voice. And as I said, the swallowing, and then a kind of an issue that children can be diagnosed with is called developmental language disorder. And the current thinking is that there are 2 children in every class on average who have developmental language disorder. And it's kind of a hidden disability because it's not immediately obvious, but it's to do with difficulties learning language. So there are developmental issues which can emerge over the period of the lifespan in terms of development, but you can also have acquired difficulties where somebody has a stroke, let's say, for example, or they develop a progressive degenerative condition like motor neuron disease or multiple sclerosis. So we work with anyone really who has speech language communication challenges. Again, the modules, you can see the crossover here. So the human body structure, human body function, neuroanatomy, neurophysiology. In psychology, students do developmental psychology, cognitive psychology, psychology of learning, behavior change, for example. We do research methods. In terms of linguistics, we cover all the aspects of the different components of language, from grammar to meaning to the social use of language, and phonetics, which has to do with the speech sounds. We look at voice as well, and fluency, and all the range of difficulties that people can have across the lifespan. Professional studies then are things like the principles of professional practice, like assessment, intervention, goal setting. And we have a strong kind of emphasis on collaborative goal setting, we'll say, with families, and putting the family at the center of what it is that we do. So the requirements, again, the points this year were 5, 7, 8. And the issue again, just you need another language, including Irish, English, and another language. The Garda vetting, the medical clearance are the issues as well. So the placements have become a bit of a movable feast because of the current situation, but we do have an on-site clinic in the building. And at the moment, students are like maybe 1 day a week in the on-site clinic and we've again had to pivot because of the pandemic. So we're doing things now like more telehealth, which I suppose in a way could have happened a long time ago for people who live far from a clinic. And if it works if it makes sense to do it remotely that way. And we've also started doing simulation. It was mentioned earlier in the talk about medicine, where students there are various ways of engaging in simulation, but it's a good opportunity, I think, for students to get the nerves out and make as many mistakes as you can in a low stakes environment, so that when you go on placement, to, we'll say, a clinic setting or a hospital, that you'll have got a lot of the kind of the nerves out of your system. The clinical placements, we have a practice tutor in Donegal. So 1 year we had 17 students go to Donegal. We have a practice tutor in the Mater Hospital in Dublin as well. So students go there. The placements can be anywhere in the country, so you may have to travel. And we have a practice education coordinator who organises the placements on the basis of what individual students need. Like, do they need more adult hours or more child hours, for example? So there are 1 day weekly placements, and then the block placements, getting experience with all the range of issues we've talked about. In the on-site clinic, we have Voices for Galway, which provides services for individuals who have Down syndrome. We have an excellent clinic for people who stutter, and also a voice clinic there as well as general clinics as well. So the qualities you need for these programs, again, very similar to what we've heard already. So are you interested in people? Or do you have a curious mind? Do you like problem solving, trying to work out what's going on? And are you a team player? Interested in science subjects, and using your own initiative? I think really the key characteristics of being a people person, having an inquiring mind, focus on problem solving, using your own initiative, and being an innovative and original thinker. So thank you for listening, and over to you now for the Q&A.
Thanks, Mary Pat. Thank you. Can I just ask Saoirse, Hannah and Heather to turn on their mics and turn on their cameras, and we'll have a little bit of a chat around health sciences. So one thing that I picked up there from Mary Pat's presentation was, placement and how important it is across all 3 programs. So if I could just come to the students first of all, and maybe Saoirse, I might start with you. Could you just tell us a little bit about the placements that you undertook as part of your degree? Am I right? You're a graduate of speech and language therapy?
Yeah. So like Mary Pat said, that you do placement during the 4 years. And the first year is mainly kind of observation, and you get a little bit of a tester into some of the assessments that you carry out as a speech and language therapist, and you get to go into a school and do those with kids. In terms of the placements that I undertook myself, I did a block placement in a primary care community setting, and it was both adults and children, and it was assessment of their speech and their language. And you could have anything walking through the door in that placement. And when you do work in community, you can have that. In second year or in third year, then I did a split placement. So I did half of my placement in a school for children with intellectual disabilities, and the other half of my placement was on a childhood adolescent mental health team. And then in final year, I did a split placement again between acute hospitals, so working in a hospital, and then also rehab settings. So I was actually in Merlin Park in the rehab hospital out there. That was mainly an adult placement, and it was mainly with dysphagia, so individuals who have swallowing difficulties.
Brilliant, thanks, Saoirse. I might come to you next, Heather. You're podiatric medicine, am I right?
That's correct. So I'm a final year pediatrician.
Yeah. So what kind of place, have you had a placement yet, Heather?
Oh yeah, I've been on placement from first year. So the first years at the minute, they are on placement. This is their first week on placement. All the students be on placement all the time. So right through the course, first year all the way through fourth year. We're in Merlin Park, and it's really handy because you can get the bus from EHG, which is absolutely class. We get to do block placements as well. So last year I got the chance to go to a private practice for a month up in Donegal in Buncrana. It was absolutely brilliant because with the placements being in Merlin, it's very much you're getting to see the hospital kind of setting, whereas going to a private practice, things are very different. You're getting to see how to run a business as well, because that is something that we can do, which is great. And there's loads of other opportunities with the placements. I know in previous years students have gone over to New York as well. Obviously that's been a bit difficult with us for COVID, but hopefully now in the future things will get going again. But yeah.
Great, thank you. Thanks, Heather. And Hannah, you're speech and language therapy as well, but could you just tell us a little bit about maybe the placements that you've undertaken?
Yeah, so I'm in final year of speech and language therapy. So in first year, as Saoirse said, you get the opportunity to go out to a school. So that's just your typical primary school we went out to. And it was really to just get ourselves familiar with working with children. And some of them maybe had seen a speech and language therapist before, others hadn't. It really just depended. And yeah, we were kind of just getting comfortable working with them, trying out some assessments and a little bit of intervention as well. And then in second year, I did a 6-week block in Donegal, and that was in a primary care centre. So that was an all paediatric placement. And that was mainly kind of the speech that people would be familiar with. So people with, say, who can't pronounce their R's or things like that, a little bit of stuttering as well, and then a lot of language difficulties. So as part of that placement, I got to do some school visits as well. So seeing children in different environments, and I felt I learned a lot on that placement. Last year was third year, so I did my placement with Voices for Galway that Mary Pat mentioned. So that was on the NUIG on-site clinic, and that was with children with Down syndrome. So we actually did that placement over telehealth, which was really new for all of us. Everyone was just kind of learning about it and how it worked at the time. But again, a really good experience, and definitely something that I'd say we'll be seeing a lot more now when we qualify. And I've actually just finished my final year placement, and I did a 10-week block in the Mater Hospital in Dublin. So that was an adult placement. It was mostly dysphagia, but so swallowing difficulties and eating and drinking. But we also got to work with a lot of people who had had strokes, people with dementia, and just a really different, I suppose, group of patients that time. But again, really enjoyable. I've been very lucky with all my placements.
Yeah, really interesting. Such diversity as well from all three of you in terms of your placement. Mary Pat, I'm going to come back to you because you touched there on the points for the three health sciences, speech and language and OT particularly high, obviously. And a question I suppose we're asked a lot, Mary Pat, is alternative access routes into something like speech and language therapy. Could you maybe just give us a little bit of a sense of that, if you can?
For sure. And after, I want to say something about diversity as well after that, so remind me.
Yes, I will.
Yeah, so in terms of alternative routes, let's say, so it's for speech and language therapy, it's a 4-year undergraduate degree program. And then we have like 2 places or more, depending on people who apply, for mature students every year. So people can go through that route, and the interviews are held in the summer. Then there are other routes like the access route, and here and there, but really it is like an undergraduate full-time program. That's what's available in NUI Galway. There are other options of a full-time, like postgrad in UL, for example. You'd have to have a general degree first, but it's a full-time degree here.
Okay, so you could do maybe a general degree and then apply for a master's in speech and language therapy. That could be another alternative.
Yes, in UL though, not in NUI Galway.
Yeah, perfect. Thanks, Mary Pat. You wanted to talk a little bit about diversity.
About the diversity, so, so there were kind of 2 elements to that really. One is the diversity in relation to the clients that we're seeing, and so we have a lot of, and again, this is across the professions, but we see a lot of people who speak 2 or more languages. And Saoirse actually is a great example, I think, of career-wise what can happen as well, because she did a master's after she finished, and then applied for a scholarship, and is now a PhD student, looking at how to kind of more fairly assess language in multilingual children. So we start working with the students about diversity in first year, and we've threaded it through like the 4 years of the curriculum in terms of what are the best practice guidelines for respecting cultural and linguistic diversity. So that's one element that we cover. And then the other thing is, like Declan mentioned it earlier, about diversity in the profession, and in speech and language therapy anyway, we have a major issue with lack of diversity in the profession. So let's say, for example, if somebody had a stutter, they might think, well, I can't be a speech therapist, and that's not true. So I would say, if you feel it's something that you're interested in or drawn to, just do it then because you like it, and you're drawn to it. And those kind of, like, there isn't a barrier to becoming a speech and language therapist, let's say, to have a stutter or to be autistic or to have dyslexia, for example. That shouldn't preclude you.
Okay, great. Thank you, Mary Pat. Another question, maybe for any of your students, but just in terms of, study abroad opportunities, it's always a question we're asked. Are there study abroad opportunities, we'll say, on speech and language therapy, for example?
Not so much really in speech and language therapy. Like, we have had students in the past go on placement in Canada for definite, but it kind of depends. Obviously, the current health situation is kind of, scuppered everything. And then there are just issues around the structure of the degree program here and other places. We are in talks with Malta, the University of Malta, but again, we have to wait through the Erasmus, I think, program. We'd have to wait and see how things play out.
Okay, thank you. Saoirse, I might come back to you then, because obviously you've gone on to do a master's and a PhD. Can you tell us a little bit about that?
Yeah, so after you finish your degree in Galway, even in NUIG, there's opportunities to pursue, master's degrees. In Galway, there's 3 at the minute. If I'm right, Mary Pat, there's one in applied multilingualism. That's a new one that just started this year. There's one in childhood speech, language and communication needs, which is the one that I completed myself. And there's one in advanced healthcare and research. Mary Pat, is it?
That's right, advanced research and clinical practice, I think, yeah.
Yeah, and you can do any of those after you do your degree. And the one that I did was a 1-year program, and it was fantastic for me in terms of just having finished my undergrad and then going into it, because I found that it was a step up to what I had learned at the undergrad level. There's no clinical practice in that master's, but all of the theory that you learn, you can directly implement it when you are working clinically. And after I finished that master's, I worked for a year. I was between an early intervention team, so children under 5, and a primary care community caseload. And then, like Mary Pat said, I applied for funding to complete a PhD in kind of multilingualism and bilingualism, and language assessment among speech and language therapists in Ireland at the minute, because, it'd be like dropping me in the middle of Germany and assessing English. Or assess me in German, I would not do well. And that's essentially what happens at the minute in Ireland, because the resources and there's time constraints. It's just not feasible. So we're hoping to look into that a little bit more and have something that we hopefully can use clinically to assess these kids.
And I think just to
Brilliant.
come in there, following on from that, Saoirse, Hannah, I'm going to recruit you now for the Masters because it's such a good idea, like to do their 1-year programs. And if you're waiting, like the job opportunities are very good and everything, but if you're kind of waiting and not sure what you want to do, you could have an MSc in a year. Like it's really good.
It's a fantastic opportunity. Absolutely. Heather, I just want to come back to you because a question that we get asked in the classroom is, you know, what does a day in the life of a podiatric specialist look like? So could you maybe talk us through, you know, what you kind of do in a day?
Yeah, well, to be honest, you can't predict it. Like anything can come through the door. I'm sure everybody else can agree with me. Like you can't predict what things are going to look like. Often for me, Friday evening, last patient, I end up sending them to A&E. Just tends to happen me. Like, so, you know, another thing with our placements is like the patients that shouldn't be treating is matched to your ability level. So in first year, you start off with kind of your routine patients. And so it's just kind of general nail cutting, things like that. And then second year, we move into more kind of like specialized kind of areas. So you start looking more at the vascular and kind of motor assessments. And then in third year, then you start doing the local anesthetic training. And there's other kind of clinics as well, so kind of get more into your wounds. And then this year then, so we're doing nail surgery, getting a lot more into wounds, the MSK, so the musculoskeletal placements as well. So like there's a good variety of mix of things that you do get to see. I think a lot of people think it's just feet. What is there to it? But there's so much to it. And I definitely didn't realize how much was in it. And I really, like, I do love it. I would encourage anybody who's even half thinking about it to just go for it, really. Try and maybe get in, do a day shadowing in Merlin Park. We had a few transition year students in there about 2 weeks ago. And it really opened your eyes and you get to see like what it is like. Things can be very different though. No day is the same.
Great, thank you, Heather. And I'm so glad you brought up that shadowing, because that is, you know, for students who are maybe, you know, think that maybe this is something they want. What Heather was referring to there is you can apply to shadow some of the podiatric specialists out in Merlin Park Clinic. So particularly if you're a TY student, or even now in leaving Cert, if you think this is something you're going to be putting on your CAO, maybe to look into shadowing one of the podiatric specialists for an hour or two in Merlin Park, that will really let you know if this is for you or not. So thanks for raising that with me, Heather. Thank you. So I just, first of all, I suppose I want to thank all of the students who've joined us tonight. I know it's a Thursday, wet Thursday evening, and you're probably all preparing for Christmas exams. So really appreciate you taking the time to join us. I want to thank all our guest speakers. I want to particularly thank the students, because I'm sure a lot of them are also preparing for exams. So really appreciate it. If we haven't had a chance to answer your question, I'm going to give you an email address, and maybe Eilish, you could also pop it into the chat. It's caohub@nuigalway.ie. We monitor that ourselves. So if there are particular questions that we haven't got to tonight and you still need a response, please use the CAO hub@nuigalway.ie email. And you can also use that email if you wanted to order an undergraduate prospectus to be sent to your home as well. So thanks everybody, and thank you for joining us, and hopefully you found tonight of use. Thank you so much.